I think most people now reach out to me only to find a therapist. They're like, you must know.
I get about 2 or 3 a day from family, friends. How do you find a place you can go and trust where at a point that you're finding it hard to trust yourself? As long as you walk out of there saying, today, when I met my professional, he was able to understand me, give me a hypothesis for what he's suggesting as the management or she's suggesting as the management plan, and these are the diagnoses they might be considering, that's excellent.
Hi, and welcome to The Curious Case of. Amit is a psychiatrist and he's been in the field for more than 25 years. He's also the co-founder of Amaha. And of course, many, many things. Whole human being. Thank you for being on the show.
Thank you for having me.
Since you've been in the mental health space for so long, there are various different gaps that exist, but usually we just sit and talk about the gaps. I only want to talk about the gaps in the context of, okay, what is the most helpful way to navigate this gap as a individual person who cannot make systemic change. So before we get there, can you tell us a little bit about the start of your journey and what got you interested in the part in where your focus is today?
I went to medical school wanting to be a surgeon. I had my Masi, my aunt who just passed away a couple of weeks ago, was my inspiration to be a surgeon, and I literally I didn't want to be a doctor. I wanted to be a surgeon. And then when I started my experiences within that space, I didn't enjoy it at all. There was not enough human interaction for me. And at the same time, my grandmother was very unwell, emotionally, mentally. And I ended up volunteering for a not-for-profit in Delhi. It still exists. And really enjoyed that experience of working with young people, especially at that time, with mental illness and with psychological difficulties. And spoke to a bunch of people and decided that that's what I'm going to do post my medical school. Went off to the UK. My first patient, and I thought I'll try it out. I wasn't sure. I thought I'll try it out. It's totally left field from where I started my journey in medicine. And the first patient I saw was a 19-year-old, first episode onset of schizophrenia. And I knew this is what I wanted to do. I felt a strong connect. I felt a lot of empathy and I felt very, very engaged by the journey of not just this young man, but also his family. And I think that was the start of my journey. And that was 25 years ago now, more than 25 years ago now. I'd taken a more academic path as part of the journey. I had written textbooks and research papers, and then I realized that actually what really gives me the most joy is human connect. And so started managing services. So that this connect was two-way with clinicians and as well as families who were working in the service, from a 12 to a 40 people team to a 200 people team, and then decided that I needed to learn this better. So went to business school, came out, joined the board of a large mental health provider organization in the south of England. And the whole thing was I loved the patient contact, but I also knew that there was a lot of value to be added in being able to deliver quality at scale. Right? What was missing at Wealth at Multiple Steps was how do you build systems, processes, and access so that people can come to services early. At least for me, the biggest gap at that point was how late people presented to services. And that sounds like an accusatory statement that people are showing up late. But actually what it was the system is full of confusion. People didn't know what was happening with them, where to go, and therefore they ended up accessing services later, or services were made accessible to them later than they should have been. And what that meant was that treatment was delayed, prognosis was poorer, which means that their eventual outcomes were poorer. They didn't benefit from early treatment. They had economic, financial costs, relationship costs, social costs to delayed treatment. So all those things were my biggest problem with the system as it existed. I tried to fix it from within the system, found it very hard, frankly got frustrated, moved back to India with the idea of saying, I can build this from scratch. I think we'll build it better. I think I spent time in India off and on over this period of time, speaking to stakeholders, and realize there's a big gap in India in terms of having a trusted name or a brand that people could sort of turn to in terms of crisis, or when they were in a difficult situation. So came back, and then with the three principles, right? We're going to build something that's strongly evidence based. We're going to keep the client at the center and the family at the center of what we build, and not build it around other logistics. And we're going to use technology to scale a continuous service. The idea of continuity is very important. So we leverage technology for that. Yeah, and 10 years later, here we are, still trying to build. But that's been the journey of Amaha.
What interested me in your whole journey was that you started from a place where you were really excited about working. You sort of found your passion, and you wanted to do this. You noticed gaps. You came back and were like, okay, I'm going to fix this and do it. And then again, you learned then the realities of trying to build and create that system in the way that you had wanted it to, because you saw that that is what is needed. And so based on all the experience in the front-facing part of it, as well as in the trying to make change part of it, what do you think is the biggest entry barrier for someone seeking help? Because we talk about stigma often. But apart from stigma, what are the more subtle or invisible barriers that people maybe don't recognize?
I honestly think that stigma is a barrier, as you rightly said. But where we are today, especially in the urban part of the ecosystem, is becoming less and less of a barrier. I think the bigger barrier is confusion. And that exists at multiple levels, right? There's a confusion about what is really happening with me. Because it's not clear, right? It's not a pain in your leg or a bruise on your elbow. It's like, okay, what is really happening with me? And there's a confusion around that. And so it takes some while to understand, okay, this is something that might require mental health expertise. Then there's some confusion and fear around, what does this mean? Where do I go with this? Like, so who to access, where to go? Not just first, it's like what kind of professional, what kind of setting, and then who can I trust? And so I think those barriers of it not being, then being no seamless, clear, trustworthy point of access today, I think is a huge barrier on the client facing and the family facing side. At least it's not clear to people first that there's a recognition gap. That's okay, this is what's happening with me. And even when that gets met through hopefully good family friend support, then there is still an access gap because not enough people talk about their own experiences. So if I'm going to a therapist, it's not necessary that I'll share that with a bunch of people. So it's unlike other parts of medicine where referrals form a big part. This becomes a challenge here. So I think that's the biggest barrier for me, the confusion that exists at the beginning. And sometimes I say the beginning, but sometimes that beginning can be 10 years, right? So it's not just a period point in time. It could just be a phase in your life when you're struggling and not knowing what to do with it and where to go with it, and that's not somebody's fault. It's a systemic failure in terms of what's required today.
I don't know whether this happens in other countries or not, but I have noticed that, in our culture, getting a reference from someone is kind of how you trust your doctor, because like someone else has been to this doctor. I know this, I know this GP, I know this surgeon, and you sort of recommend to your friends and family where to go. So not knowing, I think most people now reach out to me only to find a therapist. They're like, you must know.
I get about 2 or 3 a day from family, friends, extended circles saying, who should we see? I understand that completely. How do you find a place you can go and trust where at a point that you're finding it hard to trust yourself?
Okay.
Right? So that's the biggest, I think, the gap.
Okay. And my next question is about the lack of trust in the mental health care system. Because I think it's not one thing that creates that distrust. There are a couple of different things. One, like you just said, is I'm not necessarily being able to trust myself. I'm not understanding what is going on. So there's one where I don't necessarily trust my judgment. What else do you think causes the lack of trust in the mental health care system?
we've not really done ourselves any favor in this space in how we have really approached it, at least how we've spoken about it externally, and sometimes by not speaking about it enough, and sometimes not speaking about it clearly enough. But I think there are three areas where I would really pin it down to, which is clarity, competence, and consistency. Let me break those down for you. When you end up going to see somebody, if there's not a sense that you've been heard, if there is no sense that you've been understood, if there is no sense that there has been a reflection back to you about how somebody else has understood you, it's very hard to build that trust in the first place. And then, based on understanding, having at least a clear hypothesis of what's happening and what is our plan with that, which we develop jointly or collectively, right? When I say collectively, when I say you, the clinician, and the family, collectively done. And family is a big part of what happens in India, right? Both good and bad. So I think that's the first step, is that clarity is very, very important. It's really missing in large parts of our care system today. And by the way, there's some fantastic clinicians out there, but there's also systemic issues around how much time can you spend with the clinician, with the client. Are your systems set up to so enable you to be able to give better understanding, because there are systems that support you in doing that. So that first clarity, the first step is clarity, right? Second is, are you able to then reflect back in a competent manner what is the plan of action that will work for that person or that family, and it's meeting them where they are, essentially. And that requires you to understand very deeply the person, the science, and then the evidence based around options, and then taking all that together and putting them back in the context that will work for the person's understanding and their ability at the time is very, very important. So what I mean, let me just break it down. What I mean by that is, I have heard you, I have reflected back to you what I've heard, so that we've sort of aligned on that understanding. I have then, sort of based on my experience of the science, come with some kind of formulation, so hopefully a diagnosis of what's happening. And based on that, we've collectively come with a plan by discussion. Okay, these things work on medication, these things work in the types of therapies, this is what you might want to do socially, this is what you might want to do from physical health perspective. So we discuss the options, come with a plan, and then we regularly review the plan, saying, okay, because that's one part, is making the plan, and then we regularly review the plan. It might not be the answer, it might have to be iterative, it might not be one step, but you walk up with some sense of answer. You can only do the clarity if you as a clinician have competence. That means you really understand, first have the ability to build an empathic conversation, get the understanding of the other person, try and put yourself in their shoes as much as possible, and then based on understanding, you really are able to apply your knowledge and your experience of the science to that person's context. That's what competence means, right? If a client walks out of there feeling not heard, feeling not understood, or not understanding what is happening, then somewhere there's a gap. And that gap can't be pinned back on the client or the family. It's your job to make sure that the person, as they walk out, understand. If they're not well enough to understand, at least somebody in their care system understands what's happening. And that's the competence. The third part that's sort of required is, I'll put it in two parts: coordination and continuity, right? One is, mental health is not an individual sport, it's a team sport, right? So you need a dance between the family, the psychologist, the therapist, the psychiatrist, sometimes the social worker, sometimes another professional, sometimes the school if you're working with them, sometimes the workplace. It requires a complex dance of coordination, and somebody in the mental health ecosystem has to take on the responsibility. So to say that, okay, I will help you coordinate your care, because we know that coordinated care is effective care. And we know that that's what brings the best outcomes. Secondly, understanding that this is going to be a process where if the continuity drops, the outcomes will drop. So that coordination and continuity become the very, very important part.
That's what I meant. Like, often we talk about the gaps and then we sort of leave it at the gaps. And I don't want to do that. And the idea is not that we'll necessarily find the right answer for people in this episode, but it's to the best of, from our experience, this is the most helpful thing to do in this situation for an individual. For example, if we start right in the beginning of the confusion aspect of it, right? In terms of recognizing what you're going through, or trying to understand what you're going through. So my general advice to people is that if you're confused, if you have any doubts, then just go to a mental health professional and ask them. Because what's the harm? Do you have other suggestions in terms of step one of recognizing that you might need to go?
I normally tell people that if you struggle for longer than a couple of weeks with not feeling okay and not understanding what's going on, then you should go and see somebody. Right? That's what I normally say to people. And where things are in India today with our level of awareness, overcoming access barriers, by the time you are feeling that way, you most likely already need help. I mean, if you're not sure, if you're still finding it hard to go somewhere, read up a bit. Don't just ask random strangers or friends, because they will all give you a view from their own perspective or life experience. Best option is go see somebody as a professional, somebody with an MD degree or an MPhil degree. If it's a clinical problem, would likely be a good first port of call. Yeah, in India especially. And if that's too high a mountain to climb at this point, then at least read up yourself. And there's enough information available now from credible sources, a bunch of websites for mental health in India and outside. Read up, and that might help you point out if you're not able to go and see somebody as a first instance, actually.
Do you think at this point, if you Google lived experience, you would get something on YouTube?
Yes.
Hannah? Because talking to someone in your immediate family and friends, they might have stigma, they may have various things. So I think I wouldn't say don't talk to people, but I think if you talk to people and check the internet.
And so I was speaking to an investor a few weeks ago, and one of the very interesting they said to me was that an astrology platform in India that they've invested in, 70% of the traffic there is mental health related, right? Which is, so my point is that people go through different avenues when they're first struggling. But I'm saying speak to a trained professional. That's your safest bet. If you can't do that, because for whatever reason, right? Take my access cost. There are multiple reasons why you might not be able to do that. Then speaking to somebody who you trust, plus then doing your own research might be the next best option, essentially.
Mm-hmm. Do you think a GP may also be like a low stakes touch point?
Very variable quality. I think, and a good GP is worth their weight in gold, honestly. Any part of the world, if you have a good GP, they're literally amazing, right? But the problem is it's rare to find a good GP. It's not that easy.
Right? It's easier to ask friends and family for a good GP.
Yes, that's possible. That's a very fair point. But I think we also find that during a medical school, during other training experiences, your mental health and psychiatry exposure is very limited.
Yeah.
So that it's not, again, it's nobody's fault. You're just not trained enough to recognize symptoms and then signpost well in our system.
Okay. So the recognizing is if you're feeling uncomfortable for long enough and it's crossed your mind, just go or do your research and look up a bit and then make your decision. Next is where to go.
Yeah.
Whatever barriers exist. Given that they exist, what would be your best advice? One, though, we don't have to do what ifs, because literally you are watching this podcast. We will put in the description below some options of places that you can check out. So that is one thing. But what else?
I always tell people to look out for 2-3 things, right? One is really to look out for the qualifications and experience of the person you're going to see. A big misnomer is number of years of experience. That's helpful as a very rough guide, but actually the kind of things they're trained in, the kind of things they say they do, that's the starting point of screening a place out. Even before that, there's a step which says, what kind of professional should I go and see? A therapist or a psychiatrist? That's hard. Again, if you search the internet, it'll give you a good sense of that. But frankly, if you can't decide, it's better to just go see somebody, either a clinical psychologist or a psychiatrist with an MD or DNB qualification.
So you could technically be like, this is what I'm experiencing. Should I go? Which professional should I go to?
If you say, should I see a therapist, psychiatrist, most likely you'll find out. And actually, it's okay if you get that wrong. That's not, also important not to stress about that too much. As long as you go to a good clinician, they will signpost you to the right one.
The next one, yeah. So that's the other thing that I tell people, that go to whichever one.
Yeah.
It doesn't really matter. And the framework that you should keep in your mind is that if they're telling you to take medicine, they should be able to explain why. If they tell you the other profession is not good, they are not good. So if they are pitting,
I've never thought of it that way.
if they are saying no, that is not a good idea to do, they should be able to explain to you why you need them and not the other. And that's a fairly good indicator of whether you have found a decent professional or not.
I agree. No, that's a very interesting point. You say that if they're telling you that a professional is not good, they're not good. I completely agree with that. I think, as I said before, it's a team sport. There are different roles that 2 or 3 key professions play within your recovery, depending on what your sort of core presentation is. So anybody's telling you that, yeah, you don't need the other profession is a problem in this first place, right? But the second layer you can look at is there a multidisciplinary team working together, which means that are there a group of different types of professionals working together in the same team or under the same roof? Because then there's more likely, there is this degree of insecurity that exists among some clinical professionals, especially in the early parts of their career, where they don't want to lose a client. So then it's, if you go to a space where people are already working together, you're more likely to not have that barrier. So there's a multidisciplinary team, then you can go and speak to them. And then they will manage internally and cross-refer internally. That's the second. Third, ideally, if you get a referral from a trusted friend, family member who's gone and had a good experience, that's very valuable.
One of the things that I also like to point out is that a lot of times we work with this what if scenario, whereas literally if you are watching this podcast, there will be resources in the PDF below that you can check. But it's important that you make your own informed decision as well, and therefore keep these things in mind so that even if someone does give you a referral and you're noticing these red flags, then you can, take a step back and make your own decision as well. So that would be the where to go part of it. Do we have more private practitioners in this country versus services where they have multidisciplinary professions under a roof?
Most places, the majority of delivery today in India is private practitioners, and some very good ones. But that's the majority delivery. Some of them will work in a multidisciplinary way, either in the same setting or they'll refer and cross-refer. The good ones will always do that.
So even if I'm a private practitioner, I will have other people that I know that I refer to as whenever I work with people. So, because, in that case, then it might be difficult to find a space that has multiple people under one roof. But then know that even private practitioners can refer you to different places. And if you're mindful of that, then you can make sure that it's much harder, but that you are then coordinating multidisciplinary care. Or if you are a family member, then you're helping do that. Not ideal.
It's much harder, right? Because I think one of the things that makes mental health care delivery so much more difficult compared to other medical disciplines is that this is a time when you're struggling with your energy levels, your motivation, your being able to think clearly, right? And those are the faculties you need to be able to coordinate. You need high levels of motivation. You need energy to get up and do this. You may need to be able to think clearly. And so it's very hard, which is why coordinated care as a process becomes so much more important in mental health compared to all other kind of chronic illnesses.
I think that might be a really helpful thing for friends and family to know, because as friends and family, sometimes you struggle in terms of how can I be of help. And I think just making them realize that booking my appointment for me and helping me keep track of those things and making sure you're there in the appointment to note down what the doctor said to me so that 3 days later when I'm feeling lost, you can remind me. All of those very small things will make a huge difference to my adherence, to my maybe decision making or things like that.
I mean, if you can find a trusted soul. Absolutely right. And I think the family in India is a double-edged sword, unfortunately.
I mean, even friends.
Yeah.
So you
Yeah.
can also
Yeah.
ask a friend.
Yeah. Absolutely right. And I think, but I completely agree with you. If you have a soul you can trust, whether it's a friend, it's a family member, it's like worth their weight in gold. And at that time of your journey, essentially, because for all the things you just pointed out, right? And but also it's scary. Biggest problem with mental illness is not anything else. It's lonely. It's scary. It's very isolating. So actually having that ecosystem around you which can support you at that time, not just logistically just talked about, but also just emotionally and knowing that you're somebody's there. And I think from a friends and family perspective, it's very important to understand that the biggest thing you can do is be there and not always try to solve the problem, try and give a solution, try and tell them what's not working. I think if you really want to support, I keep telling people just create a safe space that people know that they can lean on you when they need to. Be there for logistical support, be there for days and nights, especially when someone is feeling lonely and scared, basically.
And I'm going to make a video on what is a safe space because I think it's very important. We keep saying safe space, but how do you create a safe space? There will be a video in the description below. Okay, so the next thing that we talked about was trust, and within trust there are a bunch of things, right? All professions have some professionals within them whom you cannot trust, and there will be some that you can trust, meaning everywhere there will be some people who are not so good and there will be some people who are good. But specifically in the mental health space, there is more distrust than in other spaces. A stigma and fear of the unknown. I think I live in a bubble, and a lot of us do, especially if we're working in the field, where I just assume that at this point, everyone must know what depressive symptoms are because it's just on Instagram all the time. How have you not heard what depressive symptoms are? But I'm in a bubble. There are a lot of people who don't know. They don't even know that depression is an illness. And when I say that, that means there is treatment for it. So it's actually, right now, I'm saying it as a good thing that it's an illness. It's a helpful thing to know that it's an illness because that means there is treatment for it. And you don't have to feel like there is nothing I can do about this. Okay, let's just start from I meet a professional who has limited time. Or maybe would you say that that's just something to be cognizant of? That I may find a professional who does not have time. Therefore, the most important thing for me to get out of this session is XYZ. Most people don't have enough money to go to a professional who has enough time to give them.
It's so hard because you're again, not you, but one is again expecting this individual who's struggling so much to then hold that responsibility for themselves again.
No,
And,
100%.
no, but I'm not saying you. I'm not saying we all are. I mean, in the ecosystem, we all are because of logistical challenges and the economics of how it works. And time is one factor, but you have to feel heard. Because actually, if you're not feeling heard and you don't walk out of the room feeling that you've been heard and understood, you're less likely to recover, you're less likely to have hope. So actually, it's not just a problem of, oh, I didn't give me time. It's a problem. It actually feeds into your outcomes and recovery, how you feel at the end of the session. So I would look out for that. I would look out, how did I feel at the end of this? Did I feel heard? Did I feel understood? I might not have agreed. I might not have liked what they said, but did I feel that they understood me? And then they said something I don't like, and that's still okay. But did I feel heard and understood at least? I think the second thing is you can.
Would you say that all competent professionals in a relatively short period of time should be able to at least make you feel heard? Even if they can't give you like full answers right now, they should be able to make you feel relatively heard. As a person who's trying to find a professional who I can trust, who I can go to, it's not an ideal world. It doesn't necessarily mean that they're a terrible professional, but if I need to make choices for myself, then a good enough mental health professional in 10 minutes should be able to make me feel relatively heard.
It's hard, but let me flip that question around and see if this is what you're trying to ask. Should I expect as a client to be heard and understood? Yes, every time. Right? Is that the standard everybody should meet? Yes, they should. If as a client I don't feel heard or understood in a particular clinical encounter or clinical session, then for whatever reasons might be, it's not the right session, it's not the right fit for me.
Yeah.
And it could also be that it's just not the right fit.
Yeah. It
So there
may
will
not be
multiple
a
reasons,
comment on the
multiple
professional.
reasons why that happens. But absolutely, your expectation from that session, at least the first session, should be that you felt heard and understood, should be that you walked out of there with some clarity on what might be happening. It might take more than one session to really come to grips with it, but at least that clarity that, okay, we need to talk more before we can really understand what's happening. So I'll see you again and give you that clarity. And then once that clarity arrives, and what are the next steps and why are those next steps existing, and the clarity on those, I think that should be the very basic expectation. If you're not getting that, then you need to look elsewhere.
Okay. So that does not mean you have to agree with the person.
No.
And so if a professional tells you something you don't like hearing, that does not necessarily mean you should change them. That might just be the reality of the situation. So to being clear that disagreement is not the same as not being heard.
Absolutely.
And that clarity on the next step can be as small as we need to meet again.
Absolutely. So as long as you walk out of there saying, okay, till this point is understood me or she's understood me, we both recognize that we need to go deeper into this and might need 1, 2, 3 more conversations to do that. That's absolutely fine. And sometimes that's what it takes, especially if you've struggled with something for a long period of time. There might be many layers to unearth, and there might be many things to think about, and then come to a true comprehension of a fairly complex picture. So that's absolutely fine. But if you walk out of there saying, I don't know what happened there, and you didn't feel you could ask, then it's a problem.
So that actually then answers the clarity, the diagnosis, and the treatment part of it, right? Because not in one session necessarily. Across sessions, I will share, feel heard. This person will explain to me kind of what is going on. Together, we will eventually reach some amount of, okay, these are the next steps we're going to try. This is why we're trying them. And we will keep touching base to see if this needs any change.
I would say that if somebody can't give you the rationale for the plan they've come up with for the end of the session, it's a problem.
Yeah.
Right? So I'd say that actually, even if you're saying we have to meet once more to figure out what it is, I would still tell you, because we need to just explore this a bit more. If you have to take this medication, this is what I think the working hypothesis is. I don't have a diagnosis yet. That's absolutely fine. But I'm going to give you something to alleviate the immediate distress. That might be the medication. That might be some techniques, psychological techniques, while we still figure out what it is. Or I've figured out at least what my working hypothesis or diagnosis is. I'm going to start treatment, and we're going to keep reviewing it to see if that stays the consistent diagnosis. So we often give people a working diagnosis rather than a final diagnosis. Or sometimes a final diagnosis is given at the end of the treatment. But I have to have some hypothesis for my plan. Otherwise, I'm just shooting in the dark. So,
and it's not my responsibility to understand what you're saying. Like, as in, if you cannot explain it to me in words that make sense to me, that's not my fault. You, as a clinician, you should be able to explain it to me in words that make sense to me.
Absolutely. I think that's a core skill of being a mental health professional.
So I don't have to feel like I'm stupid. I just don't understand what they said. They must have said the right thing.
If you walk out of there feeling you're stupid, then you should look elsewhere. I can't be more direct than that.
Okay. One of the things we had talked about earlier was, okay, so there's two. There's one is misdiagnosis, and then there's one that's overprescription. So let's start with misdiagnosis and then get to overprescription.
Okay, I had just one more category, which is no diagnosis.
No diagnosis, okay.
So I think the biggest problem that I see so we see about 2,500 new clients a month. A lot of them, fortunately or unfortunately, have been elsewhere. Fortunately, because at least they've gotten some help. Unfortunately, because that means that help wasn't good enough, so they've had to come to us. And a lot of times, what you hear is, I don't understand why I'm taking this medication, or why I'm doing this kind of therapy, or what is happening in the sessions. And that's okay. I'll explain the exceptions also. And that's okay. for some things, but for most things, there has to be some working hypothesis of what the treatment is for. A lot of times what happens in India is that you will go see a professional, especially on the psychiatry side, and they will write a prescription, and you'll not always know what's wrong, right? And sometimes it's like it's not in the best interest of the client to know diagnosis. Fine, but you have to explain to them something as a hypothesis for what you're treating them for. And if they're not well enough to understand that, then to some family member, because if they don't have that kind of insight, then you need to involve somebody else in their care as well who has the insight to be able to work with them, especially if they're having a psychotic episode or whatever, which is impairing their insight in the moment, or they have got delirium or dementia or whatever, right? So that's I think is the biggest problem rather than misdiagnosis, where actually there is at least the client doesn't know
What the
diagnosis or the hypothesis is. Then there is a problem of misdiagnosis, which sometimes it's actual misdiagnosis, sometimes there are diagnoses that overlap, so it's also just a different professional opinion, and that is okay. Right? Because if there is an overlapping professional opinion, your treatment typically would be very similar. If somebody says you've got schizoaffective disorder and somebody says you've got schizophrenia with mood disorder, then actually your treatment might not be that dissimilar on a day-to-day basis. So that's okay. And those are hard things diagnostically, right? So I won't begrudge anybody for making those mistakes. But if you've blatantly missed something, you miss psychosis completely. Right? You miss OCD symptoms completely. And that happens. OCD gets misdiagnosed as anxiety a lot. Psychosis gets misdiagnosed as anxiety a lot. And if those things are happening, then yes, that's a problem. But frankly, we don't see as much of that, at least. At least even the people who come to us from somewhere else, we don't see misdiagnosis. I think we get trained pretty well in this country, as psychiatrists especially. So
I think that for me was more of a thing to point out to the audience, because as someone who is on the patient side of it, I know that there are often times where I don't realize what all I need to share.
yeah.
And if I don't share enough, then how is the doctor going to be able to give me a holistic diagnosis of what, or make a informed decision of what my diagnosis may be? So I feel like a lot of times, A, because we minimize things, B, because we just don't realize it's something we're supposed to tell them, because we don't necessarily understand the link between mental health
Correct.
and the other parts of our life, right? And there are some illnesses like bipolar disorder, which can be complicated and tricky to diagnose because you have to see them across a period of time. And specifically with bipolar disorder, it has lows and highs, and I will probably reach out only when I'm feeling low because I think I need help. And then I will tell you about all my low symptoms, and then you'll give me a medicine that will actually induce the mania. And so I think it's important for people to realize that you need to also give your clinician some amount of time to work with you to understand what's going on, assuming they have met those other criterias that
Absolutely.
you've talked
Which is
about.
why I said, right? Sometimes all you can get in the moment is a working hypothesis. Right now, I think this is this. In this example you gave me, right now I think you have unipolar depression. I'm going to treat you with an antidepressant for that. But now I've seen this person for 2 years and they've had 2 hypomanic episodes where they've been very high and displaying ICD symptoms of hypomania. Then I've now concluded that they have bipolar disorder. Now it could be bipolar 1 or 2, depending on what induced it. So there's diagnostic complexity that comes out.
You didn't need to understand any of the words that he just said,
Yeah.
but basically there are multiple different
I'll explain that. So I said, basically, sorry, that's very fair. But basically, what I'm saying is, as long as you walk out of there saying, today, when I met my professional, he was able to understand me, give me a hypothesis for what he's suggesting at the management or she's suggesting at the management plan, and these are the diagnoses they might be considering, that's excellent. And because the label doesn't actually matter beyond a point, right? Label matters more longitudinally in the long term. It could be bipolar, it could be, but today what do I need? Have I understood, have I felt that they've understood me enough to tell me that? And have they been able to explain to me what they've understood? And based on that, they're giving me this treatment or medication based on this hypothesis. And if it fits into a diagnosis today, great. If it doesn't, diagnosis can often be more longitudinal as well.
So the competence of the mental health professional should not be judged based on, I should be able to give you a correct answer today, and know that some illnesses are trickier than others. Some present themselves across a period of time, and so it'll show itself and you just have
Absolutely.
to live with that. That's one of the characteristics of mental illnesses.
Mental illness is iterative, takes time, and sometimes you just have to give it that time to show itself.
Also, it changes based on your circumstances.
Absolutely.
As the world around you changes, if there was a very stressful thing that happened, like COVID, things in your life can
Absolutely.
change.
You'll go and it'll look like anxiety, and then after a year it'll be like, actually, let's step back and look at this. Is not getting better. Okay, now you're meeting the criteria of ADHD, right? Now, but it's not like you were misdiagnosed. It just wasn't obvious
At that time.
enough at the time, and you probably weren't meeting the criteria at the time. But now, as things have become clearer, sometimes it just takes time for things to become clearer. That's what happens. I'm not giving my profession a free pass. I'm also saying that there are times when it's blatantly obvious and you miss it. I think it's rare, but does happen.
Okay. And then the overprescription.
This is a big problem.
I know this bothers you a lot.
It bothers me a lot. So now at Maha we have about 250 plus clinicians, out of which a significant minority are trained psychiatrists. And one of the things we really spend time understanding is their prescribing practices. Then we audit them, we review them. It's something that I feel very strongly about. I've seen insane prescriptions in written, and prescriptions which in other parts of the world might you get disbarred from practicing. And I've seen them written on a routine basis from very senior clinicians. That understanding of why am I taking these 4 medication or 3 medication or 2 medication, right? We have to follow some basic principles of saying prescribe as little as possible for the circumstances that you're presented with, because everything comes with side effects. Mm-hmm. Right? So don't overprescribe, don't overmedicate. Mm-hmm. Right? And I don't think it's just about a doctor there. I think it's really a lack of understanding of what treatment looks like across the board. Right? So the psychiatrists or the doctors also end up sometimes prescribing more because there's a huge push, need, desire for immediate relief. And then so you end up prescribing things that might help right now, which might not actually be a good idea in the medium term, essentially. So I think it's got to be, it's hard because you're now going back to the systemic issues around how much time do I have, and can I afford for this person or 5 people like this to call me at 2 o'clock in the morning because they're distressed, and the family pushing for immediate relief because they're struggling. And so a combination of all those things leads to overprescribing. I don't think it's fair to say it's just the prescribers causing that. But what's required is somebody to say, this is what you need. I can also give you this, but this is why it's bad for you. So I can give you this as an option, which you can take if the things are really bad, but I wouldn't recommend it. But I'll give you these things. It'll take 2 weeks. It'll take 3 weeks. You won't see any difference for the first 10 days. So work with me. And so giving that understanding of saying this will not happen overnight, being confident, there's so much anxiety around this person will be unhappy that nothing happened as a client, or they'll go elsewhere because nothing happened. Or
this would be the fear of the clinician.
Yeah. And so all those things lead to then, okay, let me just make them feel better right now. And that sometimes is not the best answer. So I think the ability to step back and with confidence say, and that also gives the client confidence because it just tells you, I know what I'm doing. I'm giving you this medication. It will not show any difference over 10 days, except for you might have 2-3 side effects. So actually the beginning is terrible because you just get the negative effects of it, but not the positive effects of it. But bear with me, you'll start feeling better 2 weeks down, 3 weeks down the line, essentially. That conversation is so important because that also gives the client the choice, the comfort, the independence to make those decisions based on truly understanding how the treatment works, basically. But that doesn't happen enough. And so we see a lot of overprescribing.
And I think also for the patient or client to realize that you may not get a medication on the first day. You might not necessarily get a tweak the next time you go. And that doesn't necessarily mean nothing has happened. Because...
Exactly. Yeah, absolutely agree.
Because sometimes you'll go and then they won't change anything.
Kuch kiya nahi.
And that's okay. That's not necessarily them not
having... It's working.
That means it's working and you can continue. And a lot of times I've gone back to my psychiatrist and we've not changed anything. And I'm like, okay, cool. We're stable. We're continuing. And I think that's also something from a awareness and understanding point of view that is important for the patient and client to understand?
I think there are two layers of what is required. I'm obviously talking specifically about medication right now, right? There are two layers of what is required. One is what is going to make this illness better and the symptoms of the illness better over a period of time, and what is required for immediate relief right now. Right. And depending on the intensity of how much immediate relief is required right now, you might require medication here. You might be able to work through with non-medical, non-pharmacological strategies for the immediate relief. Right. Everything from deep breathing to meditation to a bunch of things which are hard but really work. To getting a pill to it that's going to make you sleep or make you less anxious or make you less panicky. And then there's medication that you're required to get the treatment better, and that might take 2, 3, 4 weeks to act. So I think recognizing that they're not the same thing, that this medication is not making you better, it's just helping you today, right now.
Yeah.
But this medication is what's going to get you better and then keep you better for a while. And that understanding is important. And I think that's a shared responsibility. The clinician should explain it, but sometimes the client and the family also need to accept it, because what happens is, oh no, we came to see you this afternoon and they're still distressed. And you're like, yes, it's going to take a few days.
Yeah. And I think I would also just like to point out that there are now lots of different compounds, and you can discuss with your psychiatrist what side effect you're getting and how it's affecting you. If you personally would prefer this side effect to that side effect, you get to choose which side effect you want, if possible. This should be a conversation.
So first, the side effects are scary, right? So the first thing to say to people when it comes to side effects is that when you look up on the internet about the side effects for medication,
you will get 50 million. Not all of those happen.
Yeah, it lists everything that might possibly happen. Doesn't matter how often, how rare is it, right? Some good guidelines will tell you what are the most common ones and how often do they occur, and they'll give you a percentage of occurrence, right? And that's what you should look at, and not just a blank list. Secondly, you're absolutely right in saying, you might say that I actually do not want to be dizzy, but I'm okay with a bit of nausea. I'm okay to get a bit of weight, but I don't want to be dizzy, right? I'm just making it up. So you can absolutely discuss the side effect with the doctors. And this is for where I am in my life today. And this is what I mean by meeting you where you are in your life. As a clinician, you must absolutely try and do that. Where I am in my life today, this side effect doesn't work for me at all. Is there something else? And okay, I have this other medication which has a similar positive effect, but has a different side effect potentially. So we can try that. So that conversation is very, very important, and side effects must always be discussed. And I'm going to just go back to a previous question and link it to here of time and consultations, right? Especially when you go for follow-up appointments. I would strongly recommend going prepared, where time is a challenge, with what has been the difficulties, what things have improved, what are the difficulties, how is the family feeling about it, or people around you, loved ones feeling about it from their perspective, so that you can get a second person corroboration as well. And then how's the medication going? Are you taking it regularly? Are there side effects? Any major events that have happened in your life? So I would go prepared with a few things for the treatment, for the appointment, so that you can get the most out of it, and it's most efficient both ways essentially. And one of those is side effects.
Yeah. No, I think tracking how you're feeling objectively is very important, because we might feel something is going a certain way, but if we actually wrote it down, we'd see a pattern much more clearly.
You will also biases, right? So you get this huge recency bias. So you saw your therapist or psychiatrist a month ago, but now you're going to see them today, and actually last 2 days have been horrible, and then that's what you remember. Yeah. But actually, the whole month was actually much better. If you go and present that, they might feel things have been terrible, so they might change your meds, but actually things are fine, but something set you off 2 days ago.
Yeah. I really think that being able to communicate well with your doctors is really important, and we haven't been taught how to do that, especially in the mental health space.
It's a two-way street, right? It's absolutely two-way street.
Both ways needs to be.
So let's assume that doctors are trained for it. Let's assume they'll all do it well. Not all of them will, but let's assume that. Now what you could do is go prepared, right? Especially when you're feeling slightly better, when it's a follow-up. The first ones are hard. You don't know how to prepare. Or the first one, I would recommend write everything down. Especially if you're a family member taking somebody, write everything down, share everything.
Yeah.
right? And
Overshare.
overshare. It's absolutely right. Overshare. And if you're going to get medication, talk about all the medical conditions you have and all the medication you're on already, right? Which might not be for mental health. So share all that: family history, medication history, medical history, life history, childhood. Share those things so that they get a full picture of you. But then follow-up appointments, at least how are symptoms progressing, how are you doing, any major events, side effects, medication, all those, at least have them prepared in it. So you can just get that out of the way, and that gives you more time to have a conversation. The three things we've not talked about, right? One is the continuity gap, the coordination gap, and the crisis gap. I'll tell you an example of what I mean by coordination, right? One of my very senior psychiatrists at Omaha has just seen somebody who I knew. So I'm privy to this conversation because I know this person personally, and they've been talking to me about their mental health, and so I've gotten through the psychiatrist, and they've just come back and said they need a neurology appointment, they need a dermatology appointment, and I'm going to set those up for them and then talk to those specialists before and after they see them. That's what I mean by coordinated care. I just don't mean talk to a therapist, psychiatrist, right? This is a whole person, right? And we often talk about the biopsychosocial components of mental health, but this is what it means. Actually, this person might have a neurological condition underlying, which is driving the depression, anxiety. So the depression, anxiety is very much there, needs to be treated by a psychiatrist, but looks like there might be an underlying neurological condition that has to be investigated. Looks like there is a skin condition that is aggravating it. Now I need to get them both evaluated. And that's an example of what really coordinated care looks like. Or this young person is really struggling at school with bad behavior, which is really a presentation of something else. And so I'm going to work with the teachers and the school counselors to do that. That's what I mean by coordinated care, right?
Which does not happen at all.
It should happen. And that's part of what we're trying to do. I mean, that was the whole idea was saying, because the thing is, if you keep the gold standard as saying, the idea is, I want to work with this person and this family to get them to the best self of who they are.
And given where we are right now, considering for the most part, we are very far away from connected, coordinated care. What can I as an individual do that would be most helpful for me?
The first thing you can do is share everything. Your responsibility, and it's hard to say but your ecosystem responsibility, whether it could be you or your loved ones who are helping you through the journey, is to make sure that everything is shared with the professional. Because sometimes that's the biggest gap. Once you shared everything, especially your clinical conditions, everything else, and all the psychological challenges or functional challenges, then what you can do is ask, is there other people they might need to see?
Mm-hmm.
And can you recommend who they see? Do you work so closely with somebody that they can see that they can, then that might be easier for you to coordinate as well. So if it's not being offered, at least ask.
Do you think that AI or technology is right now at a point where I can tell you everything that I'm going through, and then I don't believe everything it tells me, but if it says it seems like you need these three different types of professionals, I can consider that maybe I can meet each three? Or do you think don't trust AI right now with those kinds of decisions?
I think it's risky, but it's not a bad thing to ask an AI chatbot. This is what I'm struggling with. What kind of professional do I need to see? I wouldn't replace or take the medical advice.
Of course.
Absolutely, just to be clear about that. But actually, yeah, it might not be a bad option.
I mean, if I have nobody, if I'm not being able to understand, then...
I would not, because worst thing that can happen is you'll get it wrong in the type of professional you end up seeing. And hopefully they'll be smart enough to signpost to the right place. But I think that's definitely better than not seeing anybody. That's definitely better than not asking anybody anything because you're worried, or if you don't have anybody around you. So yeah, I think as an option where other resources are limited, using that to at least get the right signposting done, yeah, I think that's absolutely fine.
So that was coordination, and now continuity, and then crisis.
As a basic expectation, I should know your entire history, and I've reviewed your notes before I see you for the next session.
Oh, so you mean from this session to next session, I better remember what medication you're on?
Yeah, I don't have to remember, but at least I've written it
down.
Hopefully written it down. And yeah, hopefully maintain good notes. So whatever tools I use, I at least review
Oh, you
them.
don't have to remember them by
Yeah,
heart,
but at least I review them
you
before
have
I
them.
go. I think that's the basic expectation. I think setting up a strong follow-up system is important, so that a lot of people get lost to follow up because again the motivation is low, energy levels are low, clarity of thought is low at that point. So those things are as important in continuous care because these are long-term conditions, right? So you have to just make sure that people don't get lost to follow up. Essentially, that's what I meant by that.
Yeah. That there are chronic conditions like diabetes, and they will need to be checked on from time to time for the rest of your
The
life.
difference is absolutely correct, but the difference is that when you are diabetic or you have a diabetic condition, your concentration, motivation,
Is still
energy
there.
levels usually not as impacted, right? Whereas when if you're severely depressed or very anxious, then those things might be the tools that you have, the faculties that you have that enable you to coordinate might not be at their best level.
Yeah.
And that's the challenge, essentially.
Yeah. And I think I've got very lucky with my psychiatrist because there have been times where, I've gone to her and I thought, in 5 minutes I'll tell her whatever I have to tell her. It's not, I don't need the whole 30 minutes. And then she was like, no, we're going to talk for the whole 30 minutes and we're going to chat about what all is
So
going
important.
on.
That's what. So. I'm not here to plug my service, but at Amar, that's exactly what we do, right? We say you'll get a slot, you'll have that appointment, and that's what you'll get. You'll pay for that. That's what you'll get. Basically, you'll get the full 30 minutes or an hour of what you pay for, essentially.
Yeah. And to say that I may think I don't have anything else to share, but it's important that you can, and I may think I'm fine. That doesn't mean I don't go for my appointment. I do my checkup regularly.
One thing to say is that three things, right? One is it's no different to any other chronic condition, right? Where for some people, again, some people, not everybody, you might need medication long term, right? So, and be clear that that's happening because you need it. So talk to your doctor about that, and not because nobody took you off it. So speak to your doctor about it. Secondly, always important to remember that the first 2 weeks of taking medication is not what it's always going to be like. If you have the acidity, if you have the nausea, if you have the dizziness, it's usually more often than not settles down. If it's not settling down, talk to your doctor. Third, because they can change medication, there are options available. Third is the side effects are not the ones that you can just see, but they're the ones that you can't see, and they're equally sometimes more important. So some medications lead to metabolic problems, weight gain. Sometimes medications can lead to cholesterol and diabetic problems. So do talk to your doctor about side effects that you can't see and what investigations you should have on a periodic basis if you're taking certain medications, essentially.
Cool. Now the hardest one, crisis care.
I think let's start with the hygiene, right? The hygiene is if you're seeing a mental health professional, you should usually have a crisis plan. You should know if I am in crisis, who do I contact? Right? What happens if I'm in crisis? Where do I go? And crisis can look like multiple things. You might have a significant amount of emotional distress. You might have a very bad panic attack. You might have a relapse of your psychotic symptoms where you believe people are trying to hurt you. You might feel that life is too difficult, and you don't want to carry on anymore, and you might feel suicidal. So there could be a range of crises, but for your condition, for your personal experience of your condition, what those crises could be and what the plan is for them is something you must discuss with your professional. Because and sometimes the start of treatment, especially with therapies, can lead to a crisis. So understanding that, okay, how will, if I go home and then I decompensate because we had this very difficult conversation today, because sometimes it's just hard, then understanding what you do in a difficult situation, what's your point of contact, where do you go, who do you contact out of hours, late at night, I think becomes very important. And sometimes they'll tell you, go to this emergency room. Sometimes they'll tell you can call me. It's different for different professionals, but it's very important to understand what your point of contact in a crisis is. I think it's also important to have, and this is so privileged, so it's not often possible for everybody, but it's often important to understand who else you can reach out to in a crisis, which is part of a network, whether it's family or friends, right? Because most crises, the risk escalates because of isolation. So actually, so those are two things that say at the outset. I'm not going to get all philosophical and bemoan about the lack of crisis infrastructure, but and we've talked about before about lack of crisis helplines and where people can. But I think there's more stuff getting available now, and it's gradually getting better on that front. But I think these are two things that start with saying, talk to your mental health professional, or saying, if in crisis and whatever that could mean different things to different people. What is my point of contact? What should I do basically?
Yeah. I mean, I have other thoughts in my head, but I feel like they're more round conversations that don't really lead anywhere, because that's more, we will do our best to find resources that we can share with you guys about the different kinds of crisis centers that do exist in the country and where you could reach out to. Because like you said, I can give you helpline numbers. They don't always work. There have been times when someone has reached out to me and there's been like a very serious emergency going on and they just did not know what to do. And only because they knew me and I knew 300 other people I managed to get them help, which is not what everyone has access to. Then also there's the cost factor. And then I think what's really unfortunate, and what I don't want to bring up because I don't have an answer, but I have to ethically bring up, is that most people don't have someone that they can...
Yeah, that's why it's very privileged. That's right, absolutely.
They may have someone, but they definitely believe and think that they don't have someone
they can talk
reach
to openly. They might not. Yeah.
I mean, that's a problem that I have found two and a half solutions to. One is go out and make friends. It's really hard, but do it now. I'm not saying do it when you're not.
You're saying do it when you're well. Yeah, absolutely. That makes sense. Yeah.
Do it right now.
Yeah.
And the other thing is, these are not about the easiest solutions. This is, in this situation, the thing that you can do that is most helpful for you would be, whatever energy you have, find someone who you can talk to. Or go to a mental health professional, whichever. One of those things you need to do. So one is go out there and make connections and friends if you feel like you don't have any.
We could do a whole different podcast on social media and remote working and how that has destroyed the social fabric of our ecosystem, basically.
Yeah, but that's not what I have to do to find friends.
So I'm saying no, but the jokes aside, the important thing is that recognizing those risks of social media, as well as if you're remote working,
just social isolation in whatever way it's showing up in your life.
That's a risk, so you can counter that more proactively is very, very important.
Yeah. So I think that's one thing for social support, or in crisis, if I need someone to talk to, what can I do? The second one that I would like to share and then get your opinion on, because I think it can be problematic, is chatbots. And my thing is that I'm not going to tell you to go use a chatbot. I'm going to tell you exactly how you should use that chatbot. So the reality is, a lot of times the helplines don't pick up the phone. So yes, horrible. Now, what do I do about it? I think that if you go to a chatbot, if you tell it you're in crisis, it'll shut down and refer you to a crisis helpline, which then again will not pick up the phone. So what I have recommended to people in the past is use this chatbot as a venting space. Just say whatever is on your mind, get it off your chest. Do not tell it you are in a crisis situation. Just keep using it to talk while the sun rises and you find a human that you can talk to. So just as a stopgap. I'm not saying take medical advice from it. I'm not saying take treatment advice from it. I'm saying use it as a thing that will at least give you a response till you can find a real human being to talk to. If you are in Bombay and it's Wednesday to Sunday, you can come to Agatsu. I know that Amaha has a call thing from
you can call us anytime. Yeah.
And then there are, go to a cafe, there will be human beings around.
I struggle to at this stage at least, this just too much has gone wrong. I struggle at this stage at least to say use that in a crisis. And I know why you're saying it, and it makes complete sense to me what you're saying. Because the problem is, if you're in, that's require you are in distress. By definition, if you think of your context at this point, you are actually in severe distress. Now I'm asking you to use a tool that's going to give you very echo chamber kind of answers. And now I'm asking you to apply judgment in this moment of distress to say, take this, but don't take this one. Right. So that is when so I'm saying I'm actually worried at this stage. I know why you're suggesting it because what else to do? So I completely get it. But as a medical professional, I struggle to still recommend it. I only because either it's shut down because of its, or it'll give you take you down the completely wrong path, right? Both things are scary for me. Enough examples of people being taken on the wrong path, right? Or people or chatbot shutting down completely, basically, right? I'm hoping it'll change. Okay, so I'm a big technophile. I don't think technology is there yet to replace human support. But I'm hoping and I'm optimistic that the next 2 or 3 years we'll see better models. I think a lot of money getting raised right now in that space itself, at least in the US. And so I think it'll change. But I don't think today I would feel comfortable saying, yeah, do that.
I fully agree with you. In a moment of crisis, it's unfair to expect that from someone. But since there's nothing else, I feel like at least if I prep you, because I feel like if I at least tell you the helpline won't pick up the phone in the first call 3 times.
That's helpful, yeah.
At least I'm setting the expectation that you'll have to call 3 times. Don't give up in the first shot. And I feel like some amount of expectation setting helps even when you're in distress, because at least 100%. It doesn't drop your hope instantaneously.
That I agree. So I think what you're saying about helplines is very valuable. They're short-staffed usually, they're busy, they're well-intentioned, short-staffed, busy, and so they might not always pick up in the first instance.
Call a few
times.
And call a few times,
and again, not to plug our service in, but we're there. We're there pretty much till midnight every day. And then there's a hospital number at late at night you can also call. So I think you can use our services if you can't get a free helpline.
Yeah. If you could change one thing about how mental health care is accessed in India, what would it be? One thing only.
I think one thing would be, and this, if I had a magic wand, I would say, can there be a clear, direct, easy, single point of access when you first want to get to services? So when you're wondering, should I, shouldn't I, where should I go? It's absolutely clear where that should. That would be the one thing I would change. I think the clarity of that, okay, if I go here, even if this is not the right place, they'll send me to the right place. And that'll not be very difficult. There'll not be too many barriers to that. I think I would just change that. I think because I think stigma is just perpetuated by that, by it being this whole idea of this magical place where does this happen, right? So I think if I could just change that, I think that's one thing I'd change.
Cool. Okay, thank you so much. Is there something that I have missed asking you that, I realize there's one giant thing that we have not touched on, which is cost.
Oh, yeah.
And money. At least in my head, the only thing an individual can do about that is to budget for it as best as you can. Prioritize what you currently need to spend money on and realize it's a health investment. And it's unfortunate that it is so expensive. But I think that there are government hospitals that do offer it for subsidized rates, and some of them are free.
So I can say there are multiple layers to cost, right? And I think there are more options available than we often realize. Often, insurance will cover. Most policies now are mandated to cover hospital treatment. Secondly, a lot of times employers or educational institutions will provide some support. So if you are in a workplace or if you are in a college or school, then there might be support available through that.
Since you said that, I just want to say there are a lot of big corporates that actually have 24/7 helplines, but their employees just don't know about it.
So we work with about 140 corporates now, and for a lot of them, we provide a helpline, right? So
check with your company.
Third is there are helplines and free services available. Some are not for profit, some are subsidized, right? I think the fourth, which is slightly more controversial, but I'll say it anyways, is budget for it is absolutely correct, because you have to think about this as more of a medium term spend and not just a one-off spend. So I think about it that way when you think about the pricing and the cost of who you go to. I do think that good professionals do come at a certain cost because they have to get paid, as simple as that. And I also have seen enough of this now. We saw 70,000 families last year. I've seen enough of this now to know that sometimes, not often, and this is a very privileged thing to say, sometimes it's about prioritization. It's about where do you spend that 1,500 rupees or 2,000 rupees for the month, or for the week, or sometimes for the fortnight. Because the same people will go and spend it on something else. And that is a prioritization question and not necessarily always a affordability question, essentially.
At least for urban cities, there are some people who can choose to, for the short term, change where they spend their money.
And I'd say it from a position of privilege, so I recognize it, but it's not very often, and it's sometimes that the choice is available.
But I think what's important, why I'm saying this, is because here I'm talking about how much importance you give it.
Absolutely.
Where you would spend that money on math tuitions, because you need it, but you're not going to do math tuitions for your whole life. After 10th standard, you'll stop, And so realize that those are decisions that are in your control if you have that luxury.
And you bend over backwards as a family to make sure tuition happen at the time, because you know how important it is.
Yeah. So I think just understanding the importance of it is one of the things that you should take into account when you're trying to figure this out for yourself.
Yeah.
Just as a helpful strategy. I'm not saying it's your responsibility to do it. Yes,
and that's why I'm being very cautious in saying it, because I recognize there's a sense of privilege that allows you to say that and allows me to say that. But I think it's really about recognizing that might not be for long term, but in the medium term, you might have to prioritize this as a spend sometimes. Otherwise, and it's like any other health spend, right? Nobody wants to spend money on health unless they have to, but sometimes you just have to.
Yeah. Okay, cool. Thanks. What I'd like to highlight is that all of these suggestions that we're giving and that we've talked about is given the fact that the system is not perfect, that the system will take time to change, and it's not necessarily fair that an individual in a moment of distress needs to take on more responsibility for their own care.
Well, yeah.
But that is what right now is most helpful for us, so that we still get the care that we need. To me, this is the most helpful. We went and we crib and we complain and we feel horrible, and you need to express those emotions and feel all those feelings.
Otherwise you go crazy in the spaces.
Otherwise you go crazy. But also then, once you're ready, do the thing that is helpful for you.
I would just want to end with two things. That one, if you're wondering if you need help, you need help. And secondly, a lot of help is available at different price points, different access points, at different times of the day, different times of the night. But do not think help is not available.
Yeah.
Help is available.
Yeah, I think it's important for them to know that it's there.
Yeah.
It's good. It's hard to find, admittedly, but it's there.
It's there. Absolutely.
Cool. We end every episode with a little activity because we are mental health professionals. I must practice what you prescribe. So it's called The Little Things. The idea is that only from this morning to now, we have to write down on cute clipboards at least one thing that didn't go badly. Because the idea is that sometimes shifting our perspective is helpful, and sometimes we don't take note of the things that go normally.
That's a great gratitude technique.
I have had the most ridiculous 2 months, and today was the first day of my chutti after that. So I woke up this morning and I was like, okay, it's not true. I had this podcast.
I'm like, how's the chutti?
But I woke up and I had I have nothing else to do, and I watched TV in the morning with my coffee, and I was just like, oh, this is so nice to have nothing to do for 8 hours straight, and then I have to go for a podcast, but it's a fun podcast. So that was one thing. And the second thing is that completely unintentionally, my mom came home for coffee, my friend came home for coffee, my cousin came out. So completely spontaneously, we had a 6 people coffee
In the morning?
party in the morning-ish hours.
That's amazing.
Yeah.
I had a very cool interview in the morning with a potential Yamaha employee, somebody with amazing lived experience, who's going to come and work in my team hopefully. So I think that was very cool. And I got a haircut.
Nice. Cool. Thank you
Both
so
went well.
much. Thank you for watching The Curious Case Off with me. In the description below, there will be links, further reading, summaries, guidelines, resources, everything that we could find and put together that we think you might find helpful. Just to reiterate that everything that is said in the episode as well as in the resources below should not be used to self-diagnose. If you have any questions or queries, please reach out to a mental health professional who is qualified. And if you like the episode, then like, share and subscribe to Agatsu Foundation, our YouTube channel. And if you want to know anything more about the organization, then you can find out at www.agatsufoundation.org.